Hello, this is Ume Registered Nurse. Today I'm going to talk about which medications we should avoid during pregnancy. So, certain drugs are known to pose significant risks to developing fetus and should be avoided during pregnancy. This drug can cause birth defect, miscarriages, developmental delay, or other adverse outcomes. So, before I start, I want to tell you that this video is only educational video. If you have any concern, you should contact with your provider. This is only educational video. So, memory trick I used to remember is think like that, avoid the wave of time. These drugs can harm fetal development. So wave, like how you are pregnant, your belly get wave. So and then a special time is only for the 9 months. So wave of the time. So this medication can harm fetal development. So wave time. So I just want to give you breakdown. W is stand for Warfarin, A is stand for ACE inhibitors, B is for Valproic Acid, T for Thalidomide, I for isotretinoin, M for methotrexate, and E for extra medications such as lithium and ibuprofen. And then what W does, the warfarin is used for the anticoagulant. And then this is risk for the fetal warfarin syndrome such as nasal, hypoplasia, skeletal abnormalities, risks of bleeding. You need to avoid because especially it's dangerous for the first trimesters. And secondly is the ACE inhibitors. This example is a Lisinopril. This is used for the hypertension and heart failure. Risk factor is renal failure, oligohydramnios, skull hypoplasia in the fetus. And then we need to avoid especially second and third trimesters. And then B is stand for Valproic Acid. This is used for epilepsy, bipolar disorder. This is risk for neural tube defect, example spinal bifida, and developmental delays. Avoidance should be needed during first trimester. T is Thalidomide. This is the use for treatment of multiple myeloma, leprosy, risks for severe limb deformities, ear and eye defect, and organ malformations. And then avoid should be done during contraindication is the during whole pregnancy. And then another one stand for T is Tetracycline, example Doxycycline, used for bacterial infection, risks for tooth discoloration, inhibition of bone growth in the fetus. Particularly after the first trimester, pregnant woman needs to be avoided. And then I is stand for isotretinoin, and example is Accutane. This medication used for treatment of severe acne, risks for extremely high risks of birth defect, teratogenic, including craniofacial and cardiac and central nervous system abnormalities. Contraindication is for the all trimesters. M for the methotrexate, used for cancer, autoimmune disease, and ectopic pregnancy. This medication is risk for miscarriage, neural tube defect, growth restriction. Avoidance needs to be done all stages in throughout the pregnancy. Extra cautions medication is like lithium and NSAIDs. Need to avoid, especially third trimester. NSAIDs used for pain relief, inflammation, risks for premature closure of the ductus arteriosus, oligohydramnios, avoidance, especially third trimesters. So the one of the question you can ask is a medication safe to take while pregnant if it is over the counter? Answer is no. As with any medication, it depends Being able to purchase a medication without a prescription doesn't mean the product is safe for the unborn child. Some over-the-counter medication are considered to be unsafe during pregnancy, so it's better to avoid the over-the-counter medications. And then I have some reference, and thank you.